Dr. Bebat here. It is getting to be spring. I want to do our medical term of the day that has to do with increased light, increased time in the sun, and that is melanoma. Melanoma is an extremely dangerous situation. Thankfully, it's not that common. Melanoma is a type of skin cancer. It is probably one of the rarest forms of skin cancer, occurring in about 1% of all skin cancers, but it is the most dangerous skin cancer because if it spreads, it can be highly fatal. The good news is that most of the time it can be completely cured if it's caught early. So let's discuss melanoma and what it is real quick. Melanoma arises from the melanocytes, which are the cells in your skin that determine your skin pigmentation. The people most susceptible to melanoma are the people that do not have much protection naturally from the sun, which would be fair skin, red-headed people, people that burn easily, etc. Melanoma has some warning signs. Now, these are not absolute, but it's some good things to know so you can watch. If you're looking at moles on your skin and you don't know whether they're significant or not, let's take the case of somebody that has a lot of moles. There is the ugly duckling sign. The ugly duckling sign is that if you have a lot of moles and they all look fairly alike, but you have one that just stands out that does not look like anything else you have, you need to have it looked at. The other signs is the ABCDE method of looking at moles. A stands for asymmetry, meaning that it does not look the same on one half as the other. You can't fold it over directly on each other. The sides are different. B stands for borders. Benign moles usually are very well circumscribed, very smooth borders. But if you have scalloped or irregular borders on the mole, it needs to be looked at. C is color. Benign moles are usually uniform in color. And it doesn't matter what the color is, brown, black, pink, it doesn't matter. If you have a mole that is multicolored or the color shifts from one part to another, then that is a warning sign. D is diameter. Usually, this is sort of a vague one because it's relative in how you consider things. But it is the size of the end of your pinky or the size of a pencil eraser. Anything like that needs to be looked at and verified. E is evolution. And by evolution, I mean how fast did that thing grow? If it's a rapidly growing lesion, that is a warning sign. Now, most melanomas do not arise from moles that you already have. About 30% of melanomas come from an existing mole. So if you have a change in a mole, that is a warning sign and you need to have it looked at. But you need to do a complete survey of your skin, looking for new moles and new changes. Another thing that people's not aware of, it doesn't have to occur in your skin. You can have oral melanomas, which occur on the roof of your mouth or anywhere in your mouth. You can have ocular melanomas in your eye, and you can have subungual melanomas, which occur underneath your fingernails. So if you have a skin change that is worrisome, or you just have a question and you need your skin surveyed, then see your physician about it and get them looked at. It could be a matter of life and death.